I am Namrita Sekhon. I'm one of the internal medicine physicians with the Everett Clinic. I actually grew up in a family of doctors, so my whole entire life I saw my parents, their lives getting affected by how their patients were doing, the satisfaction they got from seeing their patients do well, and I just always thought or always knew that that's exactly what I want to grow up to be. I did my med school back in India, and while I was in med school I was automatically just drawn towards the subject of medicine. I always found that very interesting and really fascinating, just how vast it was. So that's when I decided to go into internal medicine, and I came out to New York for my residency. I moved out to Washington after I was done with my training, and I started looking into practices in the area. The first time I heard about the Everett Clinic was actually through a physician who I met who didn't even work for the Everett Clinic, and he just had the most wonderful things to say about the clinic, even though he didn't work there. So I thought that was pretty impressive. So I applied and I got an interview, and during my interview I could tell that everyone I came across, everyone who worked at the clinic just seemed genuinely happy, and there was a sense of camaraderie and just mutual respect between all the physicians and MAs and everyone I came in touch with, and I just really was impressed and attracted to that. So I actually think that each patient is very different. Two people could come up with a similar presentation, but the way they respond to treatment or what they are looking for or what they're ready for is very different, which is why I actually take some time to get to know my patient, try to see where they're at, if they're looking for medications or if they want to try to change their lifestyle a little bit, and I try to work with them in that way to get to the best plan.